You might be interested in how blockchain can be applied to healthcare. It's not about privacy, it's actually about the data governance, which is one of the few applications that it actually has in genomics. I'm happy to discuss that more with those who are interested later. But today, the topic of my talk is about how it's difficult to invest in innovation. And I'm giving the example of our journey as Repositive as a startup in the genetics and software space. So let me tell you how this started. So I came back from a background in software development and computer science. I suddenly ended up in genomic medicine, and that was not a coincidence. It actually started from working from the data level up, looking at genomics as one of the huge masses of big data that is now coming as a tidal wave over the healthcare system. I was looking at DNA mutations in cancer, in next generation sequencing. That's the kind of technology where you can look at every individual base pair in the genome and you can see what that base pair looks like, and you can compare it to the reference genome to try to figure out what mutations are causing disease. So while I was studying mutations in cancer and genetic diseases, everyone was talking about how this was going to provide a change to the whole healthcare system. This was not going to be just looking into one individual, what is the changes in this individual. It was actually going to make a change to how medicine was applied to every individual's treatment. So it went into the talk about genomic medicine, precision medicine, stratified medicine, and I thought, oh, that's exciting. That's where I want to be. This is a change we can make to the healthcare system. So I was studying the different changes in genomics in the Netherlands. While back in Denmark, my mother, if you haven't guessed it yet, I'm Danish, but I now live and work in Cambridge, UK. But while I was in the Netherlands studying the genomics of cancer, my mother back in Denmark got a cancer diagnosis. That was a shock for me. I realized, oh, actually, she's right now getting cancer diagnosed. She's been treated by the doctors in hospital, and they're trying to cure her disease, while I'm looking at small genetic mutations in this model organisms that we're studying in the lab. But what I learned from studying how she was treated in hospital, I learned that my research was very far removed from something that made a difference to the patient. And I also learned that the standard of care of what was applied to the treatment of my mother and her cancer had nothing at all to do with what is called genomic medicine. So if any of you are familiar with cancer and cancer treatment, you might be familiar with chemotherapy. That's basically a toxin you put into the body and you hope that the cancer dies first and not the patient. That is like a shooting, in Denmark you say shooting sparrows with cannons, right? Because you're trying to kill everything and just hope that the good cells survive and the bad cells die. That is not what genomic medicine is about. Genomic medicine is about finding the change that is causing the cancer and then give a drug that is targeting that particular change. And that was what I was interested in. So I was very disappointed and very sad to see my mother going through what was the standard of care when she got the cancer diagnosis. I made a change to my career because of that, and I moved closer to the clinical application by getting a job in the company that's providing all of the DNA sequencing instruments to all of the developed world. They're sitting on 80% of the market today. The company is called Illumina. And I was working in their computational biology department trying to help them do the data analysis to make their machines and their sequencing technology have an impact in the clinical space. But then I found out that actually the bottleneck is not in the data generation. They can make the technology, they can generate lots of data, and the bottleneck is all in the data interpretation. Because you can generate masses of data and you can generate it every day, but if you cannot make sense of what comes out of that data, you're still lost. And you're still nothing closer to what is genomic medicine out in the clinical space. So why is data interpretation a bottleneck? The interpretation of the human genome requires a lot of information. And why is that? If you have any understanding of the DNA of the human body, you know that it's more than 3 billion base pairs, and each of those base pairs, any one change there could cause a disease, or it could just change the color of your hair, right? There's a lot of those changes and variation, which is just the basis of what makes us different from one person to another, and only very few of them that's causing disease. That means that to make any kind of statistical evidence for clinical interpretation, you need thousands of data sets to compare to bring the evidence to your analysis. So that means that the human interpretation is required, and that knowledge that is required to interpret needs to be shared so that all that information is available for interpretation. And that knowledge is not shared fast enough. That's all the data that's coming out of the machines needs to get into the hands of the researchers in order to make those analyses. So this is the case for every type of analysis you want to do in genetics today. It doesn't matter whether you're looking at the clinical applications, whether you're looking at creating a new diagnostics for a disease, or whether you're looking into pharmacogenomics. In any case, you need the raw data in order to make the analysis and find out what is actually causing the disease. And with the thousands of data points needed for analysis, even though all that data has been generated today, it's not accessible to the individual researcher. We found through the work that we're doing at Repositive that finding and accessing this type of data can take months for the individual researcher. You can imagine if finding and accessing the data takes months, it's not possible to get to that outcome of looking at a patient, giving them the treatment immediately on the same day as a basis of their genetic profile. It's just not possible. We know there's lots of data, but there's a need for a trusted data broker to connect all those researchers who need the data with all those sources of data out there. It cannot be just a second-hand problem that you only think about once you hit the brick wall. So I left my work in that big technology company, in that big biotech creating DNA sequencing machines. I left my job there to create first the charity DNA Digest, to bring the community together to address this problem. And 3 years ago, we spun out Repositive, which is in the capacity of Repositive. I'm here today, and we have a booth out here. We're hiring. Please come visit us. We started a company to create that trusted data broker that could connect the researchers with the data sources that are out there. We had a great start. We got lots of community support, researchers coming to us, asking us for where the data is. We got data sources coming to us, asking for how to reach the researchers. It turns out that the bottleneck is well known. We're not the only ones who realize this, but we tend to be the first one who realized that actually a solution could be a data broker, which is a bit funny because data brokers have existed in other industries before. You've seen data brokers for financial data, you see data broker for other types of data, but so far there had been no data broker for the genetic data. And that's what we started building from the ground up. And interestingly enough, the problem that we're addressing is only getting bigger over time. It's not like you can just ignore it and it will go away. The amount of genetic data that is output by the research industry, by 2025, the output of genetic data is more than the output of Twitter and YouTube combined. So since a paper that came out last year, they started talking about no longer its astronomical data amounts. No, they start talking about genomical data amounts, because the amount of genomic data is just surpassing all those other data outputs that you've seen in all the big data space. So this is a logarithmic plot, and you can see it's going very nicely linear up and to the right. That's the amount of output of genetic data over time. So this is a problem that we're facing, and this is the amount of data that we need to make sense of in order to enable precision medicine for the healthcare space. So if there's a big problem, and we're addressing it, a genomical market opportunity if you want, a big problem, we're addressing it with a well-known technology, online marketplace. You've seen it before, you've seen data brokers before, you've seen marketplaces, whether it's TripAdvisor or Booking.com. You see how it works, right? Big market opportunity, known technology, this should be a no-brainer, right? Well, when it comes to applying for funding for this kind of thing, and this is about innovation in the healthcare space, it's about innovation in genetic research. Where does the funding come from? Well, as it turns out, we fall in between the verticals. Because as a genomic data broker for research, We're clearly making software, right? So we go to software investors. Software investors, they look at us and they go, well, you're clearly biotech. Okay? We go to the biotech investors, they look at us and they go, well, you're clearly software. Okay? Well, then where do we go to apply for funding or get investment when we're doing something that is actually innovating by combining known verticals into something new and something that is actually groundbreaking? Where do you go to get that? So as long as it's angel investments, fine, you can get some individuals who understand what we're doing, but as soon as you go into the VC world, then they look at their verticals. Oh, we invest in the biotech space, we do drug discovery companies, you look software, we don't understand software. And if you're in doubt, I was once talking to a biotech investor and I was explaining them what we're about and I was saying, this is a SaaS model, and they went like, what is SaaS? Okay, this is going to be a long day. But how did we do it then? Well, we have to be a bit creative, right? We just closed 2.5 million in February this year. That's £1 million for the Danish people. And we went to all the VC investors and said, how can we get this round closed? And what we did was we actually combined, okay, if we take one of each world and we drizzle it on top with a bit of angel investors with knowledge in our space, actually, we can make that happen. We can make the knowledge from both the biotech and the software and the specialist knowledge of the genomics industry, that the place that we're working, and make it all come together. And that's how we closed our funding round. So you can see how, if this is the kind of challenge that we're up against, giving, as I said, a genomic market opportunity using known technology, what does it look like in other innovative industries? If you're just doing something that's a bit out of the ordinary, does it then mean that you can't get the funding? Is it really that investors are looking only into the vertical for what they're investing in? Well, where's all that innovation then supposed to come from? That's my question. Now I've shown you one way that it could be done, and I can say that's the way that I can suggest to the people in the room who are in the same position looking for funding. As bioinformatics and genetics becomes more commonplace, there might be actually focused investors and VC funds focusing on that as a vertical, but then again, it's just another area will be the new innovation area that will have the problem of finding the right investors. So if you ask me, there's some thought process that need to happen, both from the investor's point of view, but also from the government initiatives that actually want to fund innovation. Because they need to be willing to go across those known verticals. They need to be willing to go outside the areas as they usually define companies, as they usually define innovation and technology. Because as long as you stay within a discipline, it can only be incremental innovation, right? The slightly better battery, you know how it works. But if you want those big steps that really make radical changes, it happens across disciplines. So my advice is to identify where the bottlenecks where the bottlenecks are, depending on your space, and make sure that you invest in those bottlenecks, regardless of the discipline, because it's the bottlenecks that you want to unlock, and don't get locked into those disciplines of traditional investment and startup technologies. So this was my very brief story of this journey of Repositive and how we managed to close a funding round across verticals, and I'm happy to talk more about that. I'm happy to talk about blockchains in genomics if anyone wants to talk about that. We are hiring, and we have a booth out here. You can recognize us by the lizard. And I also have to say that my mother, she's at home, and she's always on Skype when I need her, because she made it through her cancer treatment by luck and good support from the family. And I want to thank you all for listening. So thank you.
Cool, it was lovely having you on stage. Welcome.
Thank you.
We're more than welcome to grab questions afterwards. I've got a couple of medtech people right over here, just in case. Yes, I was pointing at you, Steph. Cool. All right, and next up we've got, we're still on time.
Yeah,
we're still on time. Cheers. Thank you. Next up we've